and keeping in mind its attachments and relations. So, attachments and relations of the 12 ribs are: number 1 is the capsular and radiate ligaments are attached to the head of the rib. Number 2 is the following are attached on the inner surface. In the left shape, we have an inner surface or medial surface of 12 ribs. And the attachments are the quadratus lumborum is inserted on the lower part of the medial half to 2/3 of this surface. Look here, look here. It's a insertion and attachment of quadratus lumborum in the medial side of the 12 ribs. The fascia covering the quadratus lumborum is also attached to this part of the rib. So number one is a muscle, and number 2 is a muscles fascia. The internal intercostal muscles is inserted near the upper border. The costodiaphragmatic recess here, the costodiaphragmatic recess in a pink color of the pleura is related to the medial 3/4 of the costal surface. The diaphragm takes origins from the anterior end of this surface. That was all about attachments of muscles, fascia, pleura, and muscles like diaphragm and intercostal muscles to the medial surface of 12 rib. And the following are attached to the outer surface. In a shape in the right hand, we have a lateral surface of the 12 ribs, and I'm going to tell you about this attachment. Attachment on the medial half. Here is a medial half, and here is a medial lateral half. On the medial half, costotransversus ligament, lumbocostal ligament, lower levator costae muscles, and the iliocostalis and longissimus part of sacrospinalis. Longissimus and iliocostalis part of sacrospinalis muscles are attached to the medial half of the lateral surface of 12 ribs. The intercostal muscles are attached to the upper border. The structures attached to the lower border are middle layer of thoracolumbar fascia. Here is a attached to the middle layer of thoracolumbar fascia that attached to the lower border. Lateral arcuate ligaments as the lateral border of the quadratus lumborum, and lumbocostal ligaments near the head extending to the transverse process of first lumbar vertebrae. How about ossification? The 11 and 12 ribs ossify from one primary center for the shaft and one secondary center for the head. The next topic is about sternum, another bone in the thoracic cage that's located in front of the cage, has a amazing shape. The sternum is a flat bone forming the anterior median part of the thoracic skeleton. In shape, it resembles a short sword. The upper part corresponding to the handle is called manubrium. Here is a manubrium. The middle part resembling the blade is called the body, and the lowest tapering part forming the point of sword in the xiphoid process or xiphi-sternum. Xiphoid process or xiphi-sternum. In the left images, in the left side, you are watching the sternum in the anterior aspect, and in the right hand you are watching the sternum in the lateral aspect. The sternum is about 17 centimeters long, and it is longer in males than in females. So let's talk about different parts of the sternum. The first one is manubrium. The manubrium in the frontal view and the lateral view is quadrilateral in shape. It is the thickest and strongest part of the sternum. It has two surfaces, anterior and posterior, and four borders, superior, inferior, and two lateral borders. The anterior surface is convex from side to side and concave from above downwards. The posterior surface is concave and forms the anterior boundary of the superior mediastinum. Look here, we have a superior mediastinum here above this plan, and inferior mediastinum below the plan. So posterior surface of the manubrium is anterior boundary or anterior part of the superior mediastinum. The superior border is thick. The superior border is thick, rounded, and concave. It is marked by the suprasternal notch or jugular notch or interclavicular notch. Interclavicular notch in the median part and by the clavicular notch on each side. Clavicular notch for costal cartilage in each side. The clavicular notch articulate with the medial end of the clavicle to form the sternoclavicular joint at this point. The inferior border I'm showing to you is an inferior border, forms a secondary cartilaginous joint with the body of the sternum. The manubrium makes a slight angle with the body, convex forwards, called the sternal angle of Lewis. That I said before in lesson 1, that was a very important point, and bony landmarks of thoracic cage is a sternal angle or angle of Lewis. That's located here. The lateral border of sternum, you can see here in front view and lateral view. Here is a lateral border of sternum, the left side. The lateral border forms a primary cartilaginous joint with the first costal rib,